Samantha Morris, and I will be presenting on our research titled Living Well Together, Exploring the Process to Develop a Culturally Relevant Physical Activity and Wellness Program to Address Cancer Prevention in a Northwestern Ontario First Nations Community. I would also like to thank my fellow colleagues for their contributions to this project. I have no relationships with for-profit or not-for-profit organizations. This research has received financial support from the Canadian Cancer Society and Institutes of Health Research, Institute for Cancer Research, in the form of a proof of concept intervention grant in primary cancer prevention. To begin, First Nation communities have disproportionately higher cancer rates than the general population. Contributing factors include physical inactivity and systemic barriers that limit access to prevention and care. In response, this project sought to create a culturally relevant, community-driven wellness approach, specifically through physical activity to support holistic health outcomes. We partnered with Sandy Lake First Nation, a remote fly-in community recognized for its leadership in chronic disease prevention, to co-develop a physical activity and wellness program tailored to cancer prevention. The project had two key objectives. One, to assess participants' knowledge and satisfaction around cancer prevention and healthy living using pre- and post surveys at a community health event. And two, to gather in-depth insights through interviews with local community champions on the challenges, values, and lessons learned from this initiative to inform future development. Under our methods, our approach followed four key steps. Step 1, co-development. We worked with our community champions to co-create a culturally grounded physical activity and wellness program using Indigenous research methods. Step 2, pilot and adaptation. We ran a one-week pilot, which led to refining the program into a community event. Step 3, health event. A one-day event featured health booths and hands-on wellness activities with pre-post surveys and participant engagement tools. And step 4, champion interviews. We interviewed community champions for deeper feedback and future guidance. An overview of the Living Well Together event included 9 stations. These stations offered activities ranging from fitness testing and tobacco education to traditional cooking and growing your own food. Attendees engaged in experiential learning, culturally relevant discussions, and interactive demos, providing both education and connection. For our lessons learned under our quantitative findings, of the 27 participants, 19 completed both pre- and post surveys. There was a significant increase in overall health knowledge after attending the event, particularly around domains of nutrition and connection to the land. Satisfaction rates were high, with participants valuing the hands-on learning and interactivity of the Living Well Together event. Under our qualitative themes generated, success hinged on trust, cultural alignment, and respect. Participants emphasized the importance of adapting programs to community needs, including logistical supports like transportation and safe places. Champions highlighted the power of intergenerational engagement and blending Indigenous and Western knowledge, what we refer to as two-eyed seeing. Overall, our key takeaways from this project included culturally relevant community-led programs are more likely to succeed and be sustainable. Youth engagement and hands-on learning foster stronger connections to health knowledge. And Living Well Together is more than just a program. It's a model for building lasting trust-based collaborations in health promotion. Looking forward, we aim to refine and scale this model using the feedback and lessons from Sandy Lake First Nation to guide implementation in other communities. In conclusion, this project demonstrates the importance of working collaboratively with Indigenous communities to co-create cancer prevention strategies that are rooted in cultural values, experiential learning, and community trust. Thank you for listening.